All right, good afternoon, everybody. I'm Melanie Usher with the Arizona Telemedicine Program and Southwest Telehealth Resource Center. Welcome to today's program. So interestingly enough, our webinar tips and notes, when you joined, your phone or your camera, they're muted, but you will be able to turn them on to participate and answer some questions. You can also use the chat function if you have a question or if you want to answer that way without talking with your mic. You're more than welcome to use the chat function and write your question in. We have a post-webinar evaluation that will get sent out to everybody that attended today. And then this will be recorded and posted on our website. That URL, you don't have to worry about copying right now. I will have that in my thank you email as well. Okay, we have our standard disclaimer. I won't read it. You can read it. Please also check our websites for upcoming webinars and events. We're working on our 2026 schedule. You can also sign up to receive our e-newsletters. You can pick and choose which one you would like to do. I'll have that URL link in my thank you email as well. Keep up to date on everything that's happening via telemedicine and telehealth. And again, your opinion is valuable to us. This is how we come up with some of our topics, by getting the feedback from you, our participants. So please go ahead and do that evaluation. Like I said, I will send out that link in the thank you email after we are done today. All right, so we have Jan Brown again with us. This is part 3, leading people through change, telehealth, telemedicine, and she's retired from Kaiser Permanente. She's done this. She's our Colorado liaison with the Southwest Telehealth Resource Center. I'm going to go ahead and stop sharing here and pull up her slides. She's going to review just a little bit of our previous 2 sessions. Hold on one second here, and I'll pull up our next slides. Change my screens.
So I'm just going to test you all out. Everybody do me a favor and unmute yourself just for a second. I'm waiting till everyone unmutes themselves. If you don't do it within a minute, I'll assume you're not sitting at your desk, which is fine. Please, everybody unmute yourself. I'm just going to ask one quick question. Okay, that's enough. I want everyone to say yes or no all at once, whether you have been at one or both of the prior sessions. Yes or no, say it all at once.
Yes.
No.
Okay, so I heard 3 yeses and 1 no. Anybody else? Okay, thank you. You can go back on mute if you want to, but you don't have to. I will just remind you that I've done this a lot as a workshop and it's always been interactive. So I asked Mel and her colleagues if we could do more interactive, and she said yes. So please feel free to interrupt me anytime. You can interrupt me vocally or in the chat. I'll talk about whatever you want. So let's take a look at the slides, the beginning slides. Mel, please. So this is the first slide originally, leading people through change. And this is relevant to all kinds of people, not just healthcare. It's relevant to all kinds of changes, not just telehealth, but my biggest experience is in telehealth. And it was really hard that I implemented it before COVID. Okay, next slide, please. Everybody read this to yourself. Nobody wants to make change. I'll just point that out. Everybody on this call, you've been asked to do things in your life that you didn't want to change, and you won't do it unless you have to. We all have experiences. Next slide. This is just the beginning slides. We've already been through these, but I'll just remind you. Okay, I have a little article I'm going to read to you. You can choose to go fast, meaning tell everybody starting tomorrow, we're all going to do visits by video. It won't work. Or you can choose to go slow with all the processes that I've gone through and I'm going through today, and you are much more likely to have success, and it'll go faster. I'm reading an article from the Wall Street Journal in the last week. The title of the article is What the Government Can Do to Help the U.S. Win the Artificial Intelligence Race. And someone wrote, education is the first step in any technological development, and I would say in any change. Unfortunately, a lot of regulators around the world hit the easy button. That's like hitting go. Nothing's easy on regulation, and it ends up where you don't want it to be. The Europeans were obsessed with passing some sort of AI regulation during our first term. They charged ahead and they created the EU AI Act, and before Chat GPT was even invented. Now they've been spending years trying to refactor that particular law in order to take light of this new technology. Obviously, you're not going to remember everything I just said, but my point is that's an example of you can go fast and it won't work, or you can go slow and you're much more likely to get where you want to be in a much shorter period of time. Anybody want to make a comment on that? Agree, disagree? Have you had experience? Anybody with that, what I just read? Nobody? Okay, we'll go to the next slide. Okay, we've already been through this. Identify the change approach is basically what I just said again. You're going to tell them to do it and they're going to do it tomorrow, or you're going to take a much slower approach and go through all processes we've just gone through, meaning what's the problem you're trying to solve, what's the goal, how hard will this be, and then you'll do all the things that we've been through. Next slide. Key strategies. We've been through develop and maintain resistance, surface and manage resistance, communication plan. We haven't been through clarify expectations, but today we're just going to spend a little bit of time. It's my last topic on reinforcement strategy, and then we can go through anything else you want to go through. Go ahead. Oh, let's go to slide 40, okay? Thank you, Mel. Okay, so before we go to this, I just want to really thank, and I'll admit I don't know who the comments came from, but from a handful of people that did responses to the last survey, the feedback that I got was, please make more comments on remote patient monitoring or remote physiological monitoring and legal liabilities. And I can tell you one thing related to those two things related. And remember, I'm retired, so this is more than 7 years old, but I imagine it's still relevant. I remember two things from legal, one related to remote monitoring and one not. One is if you share an office with someone or you're doing your video visits from home and other people are going to walk through the room, be sure to let your patient know and be sure to get permission and get that recorded that they give you permission that other people are in the room or walking by. On their end, if other people walk in the room on their end, that is up to them. It's nothing legal liability at your end. The other thing I will comment on, this is a big one with remote patient monitoring, is when I worked for Kaiser Permanente in Colorado, we don't have our own hospitals here. In California, they do, but not here. And so I only led telehealth or virtual care for outpatient care. And we had to tell people, we had to have them sign something. And I encouraged the physicians to have the patient, to go through with the patients verbally before you start, that we are not going to see your remote patient monitoring data 24/7, period. We're only going to see it during the work hours, whatever they are, 9 to 5, 8 to 5, 8 to 6, not on weekends. And that's the biggest thing we had to go through with our patients is if you're having horrible numbers at midnight or at 3 o'clock in the afternoon on Saturday, we're not going to know about it. So if you pass out or you end up in the emergency room when you die, please don't blame it on us. Anybody want to make comments or questions to that? Anybody have experience with that of not reminding patients that you're not going to see their data 24/7? Anybody want to comment or question? I love when people participate, if you don't remember that. I'm an extrovert, but I love other people to participate either by speaking up, take yourself off mute, or writing in the chat. I don't see anything in the chat. I'll give you 10 seconds. Okay, I think that's 10 seconds. So now I literally am going to ask you questions that I don't plan to move on. I mean, I will keep talking. Mel will ask me to keep going, Jan, but I hope not to if I don't get any questions. I'm reading from my questions that Mel sent you yesterday. I'm reading it. If you are asked, when you have been asked to do something differently by a work leader, how has someone let you know that they're really happy with the change you've made or really unhappy with the change you have not made? Can someone please either respond in the chat or verbally? Please. You're making me sad. Nobody has a thought. I'll ask two more questions that I'm hoping somebody can answer verbally or in the chat. Oh, somebody did. By championing if happy. And when you say, Lucia, thank you so much. When you say by championing, what exactly do you mean by that? How would you champion someone that did something that you asked them to do or they were asked to do? Poor Lucia. Okay, we'll keep going. Another question I have, I'll give you the last two. Thank you. By adopting the process and teaching others. Okay, thank you. So the next question is, how would you like to be recognized for making the desired change? And the last question is, do you know other ways that people may want to be recognized for making the change? I'm going to tell you about me. Lots of people, I worked for the medical group, the Colorado Permanente Medical Group. And when I did something that was really good for the medical group and I worked for the executive physicians, I didn't want to make more money. I didn't want a bonus. I wanted to be recognized in the medical group. I wanted my boss, Bill Marsh, to literally either post it somewhere where everyone would read it or say it in a meeting. Thank you so much, Jan Ground, for helping us getting going on video visits. This is why it's been so important to us. That meant the world to me. Other people, they wouldn't like it at all. Please don't mention me. And I know people like that. Please don't thank me in public, but that's me. So let's go through these slides. Let's have the next slide, Mel. And I only have like 3 slides, so hopefully people will participate. We're talking about, like I said, specific rewards and consequences. I mean, a reward could be, I'm making this up, you guys, for anything. A day off, getting paid more per hour, getting publicly recognized, like I said, getting a promotion. Those are the ones I come up with. Consequences could be, let me think, what would be a consequence for someone a year after being trained, never did one video visit? Again, this is before COVID. Maybe have them work only a few days a week, meaning they need to be paid less. No bonus. If they're a leader, take their leadership status away. These are bad consequences, and I wouldn't do them until late into it. I acknowledge the change made is recognized, even if just privately. Okay, that's Mel. Absolutely. For me, I loved it publicly. Other people are Mel saying, I love for my boss to say, thank you so much for doing what you did, for doing your first video visit today, or your first RPM experience. It's very, very important to this medical group that you've done that. And I will emphasize over and over, not just pay, but for some people it is. For some people it's, are you going to give me my bonus this year that I didn't get last year because I didn't do anything helpful? And when I say consider frame of reference, that's we all have different personalities. Informal, daily. So again, informal would be my boss, Bill Marsh, an executive position. He's retired now in California. When I would say he would say to me all the time, not daily, I wasn't in touch with him daily, but he would just thank me all the time for doing what I did for the medical group, for answering people's response questions, for letting him know when there was resistance so he could take care of it. He would just say thank you quietly. And then the formal is, like I said before, posting it somewhere or saying in a meeting in front of other people. And Mel just said she has an opposite point of view of me. We're not wrong or right. She would, or she's giving an example of some people would rather have this quietly. Just say thank you to me from my boss. I'd rather have it both. And Dana, our organization has a program to send kudos, nice messages that their managers can see too. Fabulous. I've also seen some leaders personally send letters or emails. Can you imagine? Thank you so much, Dana. That is perfect. And again, I'll say, obviously, we're here for telehealth. It doesn't matter what this is about. It doesn't matter if it's in healthcare. I've only done this in healthcare, but people like to get recognition or get reinforcement somehow for something they do that they've been asked to do differently. And then the last one I'll say on this slide, make the old behavior harder and the new behavior easier. So let me think about an example of this. I'm thinking that the best use case, I believe, I'm 69 years old. I have osteoporosis, but I'm treated for it, so osteopenic now. I have very bad bones. I'm very little. But I've always told the endocrinologist when I see her in person, which I don't anymore, there's nothing to see. She needs the results of my lab values and the results of my exercising and how am I eating. And if I get any bone mineral densitometry and all the imaging, she needs that, but there's nothing to see. How could we make it harder for doctors, the endocrinologist specifically, to make patients come in to be seen in person, specifically for osteoporosis? They're already diagnosed. I've already seen her. I'll admit to you, I'm 69. I was diagnosed at menopause at 50. So how many times have I seen her in person? Starting 19 years ago, it was long before COVID, a lot. She doesn't need to see me in person. How could we make it harder? So this is another question I'm asking. I'll give extra, let's see, how could I reinforce this? I will thank you to the top of my abilities. I will thank you, thank you, thank you, thank you, thank you, thank you. If someone will please come off mute and say, how could you make the old behavior harder and the new behavior easier, including but not limited to what I just described of don't allow the doctors to see patients seen many times for osteoporosis in person. Is anybody willing to come off mute? How about if I told you this is a joke, that I will pay you $100, and that's a joke, I'm lying. But if I told you that I'd pay you $100 to come off mute and answer the question, would anybody do it? You can put it in the chat. Would you do it? Anybody? I won't make you come off mute. But would anybody do it for $100? How about $1,000,000? Nobody here would come. Thank you. Okay. Thank you, Lucia. That's all I wanted to say. So do you see what I'm getting at? What can we do to make to make people more willing to do things differently that makes them feel better because they've done it? Let's see the next slide. Okay. And there's a huge role of sponsors, and I talked about sponsorship last time. So again, you can look him on LinkedIn. Bill Marsh was my boss, an executive physician. He's retired now. He was with Kaiser Permanente, Colorado, and then he moved to the Permanente Federation in California. It needs to come from the sponsor. So I could tell all of you, like I just have, please come off mute and I'll pay you $1,000,000. Recognize their value. And none of you would do it because it doesn't mean anything to you. Well, let's forget about the $1,000,000. I could say it would mean the world to me. I'll say thank you, thank you, thank you. Oh, well. But suppose your boss said that to you, or your boss's boss, or the CEO of the organization. If you do this, I will tell you, no, expressing it is just saying how important it is to the boss that we all do this. That's expressing it. Modeling it is 2 times as important. Okay, assuming he's still practicing medicine, I say he, it could be a he or she, obviously. He is modeling, he's doing care if he was an allergist for patients with asthma by video, and he was modeling it. If he's not doing it, but he's telling everyone else to do it, not a chance. And I have experience with this too. And then first the reinforcement. So again, you'd rather get a thank you times three from your boss or from the three times boss's boss, than from Jan Ground, who you don't know and I'll never talk to you again. I'm exaggerating. And it doesn't matter if I like you or not, but it matters what your boss thinks of you. I think that may be all the slides I have. Go ahead. Next slide. Okay, if you're not changed to the reinforcement, you don't have to get the change. So I think that's all the slides. So do me a favor, Mel, and let's make the slides go away. And I'm begging everybody to show me your real face. Mel, you can go first. Thank you, Mel. And I'm begging everyone to go off mute. Mel, you can go first.
Ten
Thank you,
four.
Mel. Can I hear you?
Yes, you can hear me.
Okay, I can. I'm begging you all, please, to join the meeting. Pretend this is a meeting, not a webinar. Please. Nobody wants to. Not even one.
Here we go.
Yay, yay. Is it Dana?
Yes, hi. Sorry, trying to
I
get
have
the camera.
thank you. That's fine. And it says Rady Children's Health. Where is that? Where is Rady?
Southern California. So we
Got it.
were Chalk and then merged with Rady's in San Diego.
Fabulous. And do you know that I started my career as a pediatric physical therapist in children's hospitals on
Oh,
the East Coast, in
nice.
DC and then in St. Pete. And I see you came on here, but I don't know what your name is. D. Tomsic?
Dave, yes.
What's your name?
My name is David.
David. Thank you. Thank you. Okay, can we have some more, please? Please. Oh, please, everybody join David and Dana and Jan and Mal. Please, 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 please. Please, please, please. Lucia, are you willing to? Please. Okay, so Dana and Dave and Mel and Jan, let's see what it says. Need to learn what is important to individuals as 100 versus a million, private support or public support. Yes, that's true. I mean, is $5 make a difference or 100? You're right. Absolutely, Mel. Okay, so Dave, I'm going to start with you, and I hope this is okay with you. When you think about something that you've been asked to do, or maybe something in the future, and you would like to be recognized or reinforced, how would you like to be reinforced?
I don't like to be recognized.
Okay. Would you like to get money?
I would like to be paid well for what I do.
Okay, that's good. And so let's say I'm making this up. I don't even know. What do you do for a living?
I'm a sports PT administrator.
Oh, you're also a PT. Okay. And I started a sports PT program in All Children's Hospital in St. Petersburg, Florida in 1986. Anyway, nice to meet you. So, let's say, and I would not have wanted to do video visits as a physical therapist. I would not have wanted to do it. I stopped practicing a long time ago. Let's say you were encouraged and said by the bosses, we can make a lot more money this way or save a lot of space or whatever if you do care by video. And you did it, and you did like half of your visits were by video. Um, the reinforcement you would want is a pay raise.
The reinforcement I'd want because I'm doing video suddenly.
Yeah, yes.
I'd only do video if I thought it would be helpful. So we started doing video at our facility, at our big rehab place in Detroit during COVID.
Good.
Okay. And during COVID, obviously, all of our sites were doing it.
Of
We
course.
still have telehealth, but for probably 18 clinics, we probably only do now about 100 total visits a year. We probably have over 200 therapists, so that it has really dwindled down, which is appropriate. And so some of our chronic pain therapists do it, especially for patients who live far away. For where I work, we just do like it's pure sports, professional, collegiate, etc. We don't do telehealth unless it's a very specific, brief situation.
So going back to reinforcement, thank you so much from the top of my heart for just being willing to share. There's no right or wrong answers here, everybody. I swear, I promise. So what if your boss did something to you that made you say, okay, I guess I need to do more video visits, more care by video, what would that be? What would they do um to do something bad to you?
I'm not going to do more video visits if they're telling me to. I'm only going to do the video visits if it's appropriate. So
And
it's
so,
always going to be what care needs to be provided. Otherwise, that's what I'm going to do, and they know that. So they're not going to ask me to do something.
okay, so if they say, I'm just thank you for just being the model for me. Thank you, thank you, really. So if they said, if you don't make, I'm making this up, and Dave, I would never do what I'm about to say, never. If you won't do half your care by video visits starting next year, we're going to fire you. Would you say, okay, fire me?
Yes.
Okay, thank you so much. Okay, Dana, it's your turn. Um, what can you think of that would make you want to do more video visits? What do you do for a living, Dana?
So I think I'm on the flip side. I'm the telehealth manager, so I'm the one teaching people how to use the video visits.
I
So I
got it.
may
Okay,
spin what you asked a little bit because I agree with David. It's like I'm not going to go and tell them you have to do it. I need to show them the value. So if it's something like, in peds, kids go to college, they're going to be away from school, I mean, away from home. So then it's like, well, you could still see your patients through video. So try to express the value, I think, has been our main way to get providers and clinicians to be able to use it more, because if it's just going to cause a hassle to them, more work, they're not going to do it.
and just FYI, I'm both. I led telehealth and I am a physical therapist. So, um, let's focus on you, Dana,
Mhm.
specifically you. Suppose your boss said, I want you to make sure that 100% of our physicians have had one-on-one training by 2027, a half an hour each one-on-one, and you got done 999. How would you like to be? How would you like them to say thank you?
I think I do appreciate like verbal validation, but not in a huge setting. I am an
Okay,
introvert, as you could probably tell why I was a little nervous to get on camera. But I think
I
in
get
like a
it.
personal group, the team I work with, I do appreciate that verbal validation. But
Got it.
definitely in the annual review, if that's affected, because then that will affect my merit raises and such. That'd be appreciated too.
Perfect. And again, I want to say over and over and over, I say perfect. There's no right answer. Dana's an introvert, I'm an extrovert, but even so, I'm sure not all extroverts and introverts are the same. So suppose at the end of a year by 2027, you had 25 physicians of the 1,000 trained. What should they do to you? That would make a difference in what you did for a living or how you did what you did.
With that, hopefully nothing negative, but I think, it kind of depends on them. So I think even with that, if they do something like a consequence, I think personally I would take that. Even without them doing anything, I would feel disappointed in myself, not being able to do that work. So I think I would almost like beat myself up for for not being able to do at least half the provide like the work with the providers too.
And if you were your boss, what would you do?
I think I would probably sit down with myself, try to think about it that way and try to see how can I help this person make the change next year. So rather than just firing them or cutting their pay, it's having that corrective plan in place and being there for them to see what we could do.
And I love this because if we have Dave and Dana talking together, now I'm changing the topic. Let's say Dave's done one video visit in 2026 and you're in charge of making sure they do more of them. You would probably sit down with them. This is what I would do and find out what's going on, Dave. And Dave would say, I don't believe we're going to get the outcomes that I need to get as a physical therapist. I've been doing this for a long time. And then I would say, as the boss, let's look at it. Let's look at what happened during COVID and see what kind of results we get. And I would love, there's no right answer to this. I would just love to see. And actually, I've been saying this since I led virtual care when we trained 1,000 physicians one on one. for 500 physician hours and gave them each 200-hour webcams. And a year later, 97 had done at least one video visit. I have been saying all my career, I want to see the outcomes. I want to see that, are we getting better results in rural areas, better clinical outcomes because they have better access to care? Or are we making it so much easier for people to get care by video that we're making the system more expensive? So I'm totally with all of you that think, I'm not sure. I'm not sure either of what's the right answer here. I chose physical therapy because I wanted to be hands-on. So Dana, if you met with me and said, what's going on? Why don't you want to do video visits? I might say, because I went into this career to be hands-on. And I'm not sure what you would do with that. And maybe you would have to say, well, guess what? The world has changed and I'm making this up. We're getting the same outcomes. I can show you. And it's really important that we save the space and whatever that we do this. All right, I'm going to call on Lucia because I'm guessing, Lucia, are you willing to show your face and take yourself off mute?
I'll take
Thank
myself off
you.
mute, but I am not no, I'm not ready for the camera.
That's fine.
Next time, Jan.
Thank you so much.
You're
So,
welcome.
do you have any comments about what Dave and Dana said?
Yeah. So I'm a telemedicine pediatrician, and I've done it for over 10 years, and also a lactation consultant that I do in person at an office and also in telemedicine. However, just in here, sorry. For me, yeah, the numbers factor is always in play on a daily basis, weekly, monthly, and then quarterly. Believe it or not, our income is held to the numbers, but not only that, patient satisfaction with the STAR system, which I absolutely hate, right? Because even if they can't connect properly, that is basis for patients to be upset, sometimes disproportionately upset. And even if you did a great job, you're not recognized. Because you get, they could give you zero. Oh, in fact, a lot of them leave without giving you not even 1 star. And they have the ability on the chat to email to customer service, and then you get the feedback from your supervisor. This was the now you have to explain it. Sometimes they even have to get into the phone calls to see if it's truly what happened. And then so at the end of the trimester, let's just say, you held to metrics. The patient bounced back to the emergency room. The patient show up at the office within 3 days. That's counted as negative. Do you prescribe too much of a nebulizer, even saline? So that actually, to be honest with you, has eaten in me so much, and the burnout is a thing that is one of the reasons why I have halted for like the last 6 months telemedicine, and I went person to person because the you just don't, you value, I think, the lack of contact, the lack of emotion to emotion, the lack of knowing your nuances really dehumanizes the delivery of care.
Totally. So I'm totally with you. Thank you, Dr.
You're
Lucia.
welcome. I really enjoy your teaching, so I try to connect even if I have something to do. So my apologies.
It's fine. You have your work to do. I'm retired. Totally fine. I'm
Thank you.
glad you like it. So, but going back to the topic here. So obviously the technology is not working. If the technology is not working, we can't do video visits. I've been saying for a lot of years, and I'm not an IT person, technology is great when it works, period. And when it doesn't work, I mean, so your story, done, end of sentence. If it doesn't work, we can't do it. We can't take care of patients if the technology doesn't work. But let's go back to the topic that we're going through today. Again, to just pretend in our head that we're trying to encourage other people to do something differently. Again, provide care by video visits. And Lucy, I'm still with you right now. So during COVID, for example, how long did it take you to do as much care as you needed to do by video by video? How long did it take you, Lucia? You're still on mute, by the way. Oh, did she say she had to go?
No, I'm here. During
Okay.
COVID, it was so
Yes.
overwhelming. COVID was so overwhelming, telemedicine. Um, I there were there was a time that it took me 3 minutes to see a patient. I'm not proud of it. Mom wasn't too happy, but we had each one of us in each waiting room over 120, sometimes 180 people waiting. So yes. So sometimes you have the luxury of being able to spend 30 minutes, sometimes even more if there's no disconnect, because they also disconnect you, right? But COVID was pretty overwhelming. We saw patients very fast. If we could,
That's
it
not
was
good.
around 10 minutes, but there were times that you would just have to just go straight to the problem, straight to the
I get it.
answer, and move on.
Oh, thank you so much, Dr. Lucia. How
You're
about
welcome.
Annabelle? Are you willing to come off mute and show your face? Please. I said please. Mommy taught me to say please. Does that mean you're not there? I know. I mean, when I worked full time, I was so busy, all the time multitasking. How about Willie? Are you there? How about Joseph? Are you there? You're making me sad.
Jan, I
How
have
about,
Jan,
sorry.
I have a comment. So one of the things that Lucia had mentioned, she didn't like the metrics, and of course, hearing her story, and yeah, it's understanding what Dana was talking about, as the person trying to implement the change, understanding what those challenges in completing the task would be, right? And of course, that patient satisfaction, as Lucia was talking about, yeah, it can be impacted by one small piece of that whole interaction, whether it's just the logging in, whether it's something completely uncontrollable
Absolutely.
by the practitioner. And and so it's interesting to make sure as a leadership they're understanding all these other little pieces that are affecting the metrics and the process and the challenges, right? It looks like Annabelle, you're
Oh, well,
Yay.
I'm not gonna do the video, but well,
okay.
I'm
That's
just
fine.
a new graduate MP. Just wanted to learn what's out there, and I know it will be one of my tasks to do the telemedicine. So I'm just here to learn.
Okay.
Yeah,
I just wonder though, even so, you're still a person. We're all people. If you did something at work, you did a really, 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 really good job, like the best job you've ever done at something you've been asked to do by your boss. How would you like that to be reinforced? Like encouraging you to do it more, even if it was hard.
I see. I don't really need that reassurance that unless I get a negative feedback, then I would tweak my approach and whatnot. But usually, I don't really look for that kind of recognition and stuff like that. It's good to hear, but yeah.
Okay, so hopefully you're learning, and it doesn't matter, everybody here, it doesn't matter what your expertise is. This is true for everything. I mean, I would even say it's true as a mom that we need to figure out what matters to our kids to make them want to do something differently, or they're not going to do it differently. And some kids need it more than others, and some people, I needed to be recognized a lot. Other people are more, it's more important to get a bonus or to get promoted. Everybody needs something differently. So going back to what Mel was saying, it's interesting. I'm going to go back to what we talked about at the last session was surface and resistance. And now I'm going to, I can't remember who said what. Yeah. Um, I'm showing you how old I am because I forget already. I think it was Lucia that said, um, the technology, oh no, yeah, it was Lucia, the doctor. Yes, that the technology didn't work. You know what? You need to service resistance and find out from Dr. Lucia the technology doesn't work. I ain't gonna do it. I don't care how much you want me to do it. I don't care how much more money you're going to pay or how many people you're going to tell I'm doing so many video visits. If the technology doesn't work and my patient satisfaction is really low and they stop seeing me, I'm not going to do it. So that's a really good example of servicing resistance and why it's important to do that. Because it's not that Lucia doesn't want to do care by video. It's just that it's not working. Willie, Joseph, any willingness to talk? I don't need to see your face. Okay, well then I'm gonna go back to the notes that Mel sent yesterday. I just said, let's look back at the topics in the first two sessions. Does anyone have anything to share? The most important thing to me and the feedback I've gotten from physician leaders for the decade that I did all-day workshops on this was defining the quantifiable problem to solve, and you can use X, that matters to the person, the doctor, or whoever else. It matters to the person you want to do something different, and it matters to the people, the sponsor, the people paying the bills, that are making the decisions. Have you had any experience with that? Have you given it any thought since we talked about that? Anybody? Defining the quantifiable problem to solve. So I'm guessing that means the answer is no. And I beg you to think about it more. It is the most important thing. When we implemented video visits I'm going to guess 2014, the sponsors, the executives, the one paying the bills, wanted to do it because we had a low retention rate. This is Kaiser Permanente, a health insurance company and a medical group. We had a low retention rate. So we had a retention rate of 10% year over year of the low utilizing members. We called them LUMs. Those are the 20-year-olds and 30-year-olds and maybe even 40-year-olds, not the people like me who have a lot of health issues. They have no health issues. They're never going to come, and they're not going to stay the following year if they can find a plan that's less expensive. That's why the bosses wanted to do it, to retain the LUMs, because we don't spend much money to take care of them. They're the best people to keep. So they hypothesized that if we offered them care virtually, this is a long time ago, that they would be more likely to retain. On the other hand, the physicians had no interest. This is before COVID. These things I don't have data on. They went to medical school and they learned how to be a doctor. And Lucia, you can agree or disagree. They learned to be a doctor with hands-on. They chose to be a doctor with hands-on, as I chose to be a physical therapist with hands-on. And the third thing, I heard this over and over and over, but again, I don't have data. The third thing was they were worried about missing diagnoses, with the biggest one being the urology department, starting with a U. They came up with the best use case, or the chief did. I remember his name. He's retired now too. The best use case in urology for video visits was erectile dysfunction. There's nothing to touch. That's what they said. I'm not a doctor. I don't know anything about ED. We didn't learn about that in physical therapy, did we, Dave? Anyway, that's what the chief said, best use case. And maybe he even said after it's been diagnosed. But the other docs, no, maybe it wasn't before diagnosed. The other docs, when I met with the whole group, and then I had my boss come, an executive physician, because it wasn't going to work. And the docs said, three of them, I don't remember their names, said we could miss a cancer diagnosis. And again, what do I know? I'll say that to Dana too. We don't know. If a doctor says I'm going to miss cancer if we do it by video for erectile dysfunction, I don't know. Urologists know, as I guess, and maybe they're right. And then the question is, so when do you do video visits? Well, maybe if they won't come in, but quantifiable problem. So the quantifiable problem became an issue with COVID, obviously. I'm going to make up the number that X% of patients are not willing to, don't want to. I'm not sure what the right words are. Can anybody come up with the quantifiable problem to solve using the number X for why we implemented video visits and it succeeded with COVID? Can anybody come up with that? Use the number X.
Are you saying that X will be the number of
Yes.
to make it profitable or at least retention? How
Well,
many?
I'm asking, what do you think should have been measured? X would be the number, but what should we have measured to convince doctors it is important for you to now provide care by video? Because doctors think, and again, Lucy, I'm just babbling. I don't know this for a fact, but doctors believe and physical therapists believe that we'll get the best clinical outcomes if we see them in person and lay hands on. What clinical problem to solve using the number X as the how bad the problem is would convince doctors we need to care by video because there's COVID? What could we measure?
I think usability in returns. If it is patient request and satisfaction, that's measurable.
Okay. So make a statement of physician satisfaction is only X%. Is that what you're saying?
No, I'm talking about patient satisfaction.
Okay. Patient satisfaction is only X%, and we hypothesize that's because they can't come in to see the doctor. I'm making this up.
Okay, I see what you mean. Let's say patient satisfaction is only 40%, and because of accessibility, due to let's just put something reality accessibility due to poor internet service.
Okay. Very good. And Dana, I love yours. No, and Mel answered no show rates. So I'm going to ask you, Dana, take yourself off mute, please. I'm going to ask you to make a statement using the number X of what the problem is you're trying to solve for video visits during COVID.
So like just making it up, current
Yep.
no-show rates is X%. If we offer telehealth appointments, hypothesize lowering of no-show rates with better access.
Perfect. That's exactly what I want to hear. And then, and again, this is what I did with physician leaders across the country, including in Hawaii. Suppose I said, now I'm going to put a number in the X. Suppose I said the no-show rate before COVID for all patients in all specialties in primary care was 15%, and now it's 16%. Would that convince you to do video visits? No. I'm making that up. I don't think so. And then if it was 15% and now it's 40%, I'm guessing everybody here would say yes. But guess what? It's hard to get people to agree, and especially the doctors that you want to do care by video and the executives that want the no-show rate to go down. So we would have these workshops, all-day workshops, and the doctors would work together on what's your goal? And it wasn't specific on this topic. What's your goal for the no-show rate if we implement video visits? And they would work together, and that they'd have a hard time agreeing. Here's another one. Well, it's not relevant to this topic. Okay. So the clinical problem to solve is a really important one. And the X filled in needs to matter to the bosses and to the ones you want to do something different. So what about has anybody here had trouble with lack of sponsorship in implementing video visits or telehealth, remote monitoring, or anything else in video? Has anybody had lack of sponsorship problems? Anybody? Annabelle, Joseph, Willie, Santa Priya. And I wonder if PED means pediatrician. Maybe it just that's her last his or her last name. Oh no, it's Predamalu. Okay. Another question I'll ask is, imagine what would happen. So it sounds like nobody's had problems with sponsorship. Suppose you got a new boss who no longer was in favor of video visits, or in Dave's case, and I don't disagree with this, Dave, who required that every single video visit need to be done by video. What would we do? Anybody? Okay, I'll admit to you, I can tell you me, I would leave. 100% I would leave. If either one of those situations, if you have a new boss and you're leading Dana, if you're leading telehealth and I led telehealth, and I get a new boss, which actually this did eventually happen to be, but it was long after. If you have a new boss, it's not that a new boss is necessarily anti-video visits, but it's not their thing. Versus my boss, when I implemented, it was his big thing. It was his main thing to sponsor. He was there for me anytime I needed him to address resistance. And suppose I had a brand new boss because that boss moved on to a higher level in California, and the new boss just didn't care about video visits. So when I had resistance, I couldn't get his or her help. It's over. Anybody have a comment about that? It's over. Do you agree with me, Dana?
I think I agree to an extent. Depends on like maybe the other structure. If their boss is still supportive, then at least you have something. But if it
Yes.
ends with them, then I would agree.
Dave, what do you think?
So where I work, we don't really have anybody pushing video.
I get it.
They're very supportive. So if you have a patient that wants it, we're going to do it.
Okay.
Sometimes if the weather's bad, I'm in Michigan, so sometimes if the weather's bad in the winter, some of our visits might be converted to video if the patient would like to do that, if they don't want to drive to their appointment. And of course, if whatever they can do in the video matches what they're in terms of for them the value, right? Um, yeah, so I'm really lucky. Like we have a virtual care department that's very, very supportive.
Fabulous. So let's just change the topic a little bit, Dave, just to go through the thought process. Is there anything that has changed while you've been with this organization that's been really good for you? Anything that's changed that you didn't like?
Yeah, so I'm working in a brand new high-tech sports medicine building with one of our professional teams that we opened just before COVID hit. So that is something that's nice. That took
Nice.
probably 20 years to happen.
Okay.
Yep.
So we're running out of time, obviously. We have 7 minutes to go. Does anyone have any comments, questions, suggestions, anything? Oh, and Mel, I agree with you also. I have experience with this. Getting agreement to the metrics being used seems like the challenge. Absolutely, yes, as I just described. Doctors care about clinical outcomes. I'm making this up. Executives care about making money. And what are you going to do if they go against each other? The executives are going to want to do one thing and the clinicians are going to want to do another, and that's probably not going to change. So you might want to, and again, I'm exaggerating to make a point. You might want to say, okay, physicians, if you don't want to do Visio visits, you can leave. And we're going to look to hire physicians that only want to do care by video. And there are some of those that don't want to leave home or whatever and start over. But I have experienced that. Um, again, when we implemented video visits and we failed, we did have a two different set of goals of what they wanted to see. Does anybody have any questions about anything else that I've talked about, including identifying the quantifiable problem you or your problem is trying to solve with the use of telehealth, defining the goal, quantifiable goal, efforts to improve sponsorship, efforts to service resistance. It's really important because the resistance might be right, like the technology doesn't work. Anything else you've considered, tried, or having been in the prior session, anything else that from prior sessions? Anybody else have any questions or comments for me about anything? Otherwise, we're done.
I gotta say for myself, watching you, Jan, and of course being on all three of these, even though we're hosting it, it's interesting to learn and being able to be open-minded to all those other perspectives. And really, it can be very easy to be within our positions and our organizations and try not to be in the silo, but you can get pretty well focused on just your area. And it's like, wait a minute. Okay, there's other dynamics going on, and being able to understand and being open to those and getting the agreement on metrics, making sure there's understanding the challenges to complete various tasks when new tasks, get moved around or people move on and, someone else needs to pick up. So it's like, oh, wait a minute, what was the challenge? Making sure that the corporate memory isn't lost either as people are moving on. So yeah, for me, I've appreciated being able to take that step back and there's more players, there's more sponsors involved than what I thought was initially.
Mel, can you imagine how much that means to me when I told everyone that the most important thing to me is to be recognized? Thank you so much. And we are all different, and we all have been asked to do things differently. This is not just telehealth, but it's in the room what we're here to talk about, which is fine. But this could be personal, it could be professional. And I hope this has been helpful to you. And if you ever want to get in touch with me, jangrand@gmail.com. I'm in Colorado. I love to talk to people about things I have passion about. Thank you so much. Back to you, Mel.
Great. Thank you again, Jan. Thank you everybody for joining us. And thank you for those that shared your comments and turned your cameras on, turned your mics on. We really appreciate it. It's a challenge to make some of these virtual conferences much more interactable. So again, I appreciate everybody joining us. Everybody that joined, I will have a thank you email sending out with the different URL links. I appreciate everybody that participated, and we look forward to seeing you at a future webinar. Thank you, everybody, and have a great rest of your afternoon.
Happy Thanksgiving, everyone.